Next, I would like to give you a clinical scenario and work on that. Many more men with prostate cancer this is about prostate cancer, will have indolent asymptomatic disease, which will progress to a life-threatening condition. Though treatment of prostate cancer is effective, it carries a significant morbidity and mortality. Deciding which patients with prostate cancer should be exposed to treatment with curative intent is complex. So, what would be a question related to prostate cancer? Here's one. In patients with newly diagnosed prostate cancer, it's about the molecular markers. Are molecular markers of cell cycle regulation compared to conventional risk factors associated with an increased risk of mortality? So if you have positive molecular markers, which are rather new in comparison to the conventional risk factors, do they benefit? Are they useful to predict the mortality of my patients with prostate cancer? So I broke up this question into the PICO format just to demonstrate to you what is what. People with prostate cancer, this is my patients or population, and I am comparing conventional risk factors with molecular markers, and my outcome is mortality. So the next step, of course, once I have the question about the prognosis, the next step is to search for an evidence. And the mostly used resource for that purpose is PubMed, and I will use PubMed. Let me open a PubMed while you are thinking about the keywords to use. Which keywords would you implement to make this search? It's going about prostate cancer, so you would probably search prostate cancer, then molecular markers, or of course, molecular markers, risk factors, and mortality, isn't it? So prostate cancer, molecular markers, risk factors, and mortality. I would like to use this clinical queries search of PubMed. Risk factors, then molecular markers, then mortality, and what else we said? Mortality, and of course prostate cancer. So if you watched the PubMed search presentation, you should know that we have different search options, like using the code. I want to use search prostate cancer, not the individual words. Instead, I want to search for these combination of words, and I could type in between these search terms but actually, since the default search term is and, I don't need it, I can omit it. And instead of mortality, I would like to use the asterisk to search other similar words starting with mortal. And among the filters, I will use the prognosis filter, and let us leave the scope broad and see if it is we have too many hits, we may narrow it. Okay, I clicked search. Here is my results. 6 results only, okay, not so many. And if you look, molecular markers for prostate cancer, molecular markers, and that from prostate. So exactly, actually, the title which I am looking for. And I did this. I cheated when I was preparing this presentation. So I did this search before, and I came up with this article. In the rest of my presentation, I will use this article published in 2009, was that, I think, to discuss with you the appraisal of prognostic article.